Hi, I'm Dr. Austin Nation. Welcome to our presentation. I am an assistant professor at California State University in Fullerton. I am here with my student research assistants, Aleiza, Ambalada, and Jonathan Pelayo. It's a pleasure for us to be here this afternoon doing this recording for you. We're going to be talking with you about the state of lesbian, gay, bisexual, and transgender health access in Orange County. We're looking at the experiences both when individuals are accessing healthcare and mental health care. I'll let the students take it from here.
There are an estimated 9,000 LGBT individuals over the age of 14 in Orange County. And according to the National Academy of Medicine, formerly known as the Institute of Medicine, there's limited data on health needs and healthcare utilization patterns of the LGBT individual. It is known that LGBT individuals experience significant health disparities such as HIV, substance use, and mental health, more specifically, depression and anxiety. And the only data collected regarding LGBT health in Orange County is related to HIV incidence and prevalence. So this brings us to our objectives. The main focus of the study was to explore the current experiences of the LGBT population, including healthcare and mental health locations used, adequate LGBT-friendly health and mental health care providers, perceived barriers to seeking healthcare services, and finally, identifying gaps in available medical and or mental health services for LGBT populations in Orange County. Next slide, please. This is a quantitative cross-sectional study that utilizes data gathered from a survey of 55 questions on Qualtrics. In the survey itself, there are some fill-in and open responses that will be analyzed qualitatively, as well as quantitative data that will be analyzed by a contracted statistician. Statistical testing will also examine differences and similarities within racial and ethnic groups, as well as between each of the 4 LGBT subpopulations. The categories of the questions asked include demographics, barriers to care experiences, and the survey was closed about asking about a sort of one-stop shop care idea, as well as interest in future participation in focus groups, and then a raffle. And in order to reach large audiences, we partner with Orange County Community Health Organizations of Shanti and Radiant Health Centers, since we know that these are high utilizers of healthcare and mental health care services for the LGBT populations. The survey itself was available in English and Spanish and was sent out as a link via email, as well as made available per QR code on paper advertisements. And now I'll be going over some preliminary data analysis, data that was gathered. Our N was found to be 61, with about 2/3 of the respondents identifying as male. Majority of people who responded identified as gay, followed by bisexual. Primarily whites and Latinos participated in the survey, and most identified as single or not in a relationship. As far as employment goes, there's about an even split between being employed full-time or being disabled. And lastly, majority of respondents were found to be educated with a bachelor's degree. And now let's go into some of the results. Next slide, please. So what you're looking at, this is the graph for the results of the question. What are your barriers to accessing healthcare and or mental health services? Mark all that apply. And please keep in mind that the x-axis are raw number measurements and not percentages of individuals. And the most common barrier was found to be unsure which providers are LGBTQ plus competent, followed very closely by financial cost. And then there's a tie for the third most common answer chosen between transportation, feeling unwell either physically or mentally, and finally, past experience of not being treated fairly by providers or staff. And there was also common barriers found, such as difficulty taking time off work and distance to nearest provider. And it is also worth noting that no one had a language barrier or any barrier finding any childcare. Next slide, please. What is now displayed are the results for the question, thinking about Orange County only in the past 12 months, have you ever experienced or felt you have experienced any of the following by a healthcare provider? And of the 45 responses to this question, 16 reported no negative experiences. However, 8 reported neglect, 7 reported homophobia, another 7 reported mistreatment, and also some others reported transphobia, racism, and even abuse or violence. Next slide, please. And for this one, what you're looking at is a graph for the question, thinking about the past 12 months, how knowledgeable do you feel your providers are about LGBTQ plus issues that impact you? Now, this question was answered based on a scale from extremely knowledgeable all the way down to extremely not knowledgeable. And of the 29 respondents to this question, only 5 responded that they felt that their providers were extremely knowledgeable about LGBTQ plus issues that affected them. And a good majority, 16 out of 29 to be exact, felt their providers were somewhat knowledgeable. But the other 8 out of 29 felt their providers were in some way not knowledgeable about LGBTQ plus issues that impacted them. Next slide, please.
Thank you, John. The majority of our participants were able to find all of the healthcare services that they needed within Orange County, with 2/3 of the participants not having any trouble at all finding a provider that was willing to see them. In fact, almost 80% of our participants stated that they felt comfortable talking to their mental health care provider or their healthcare provider about personal aspects of their life, such as their sexual orientation, their gender identity, HIV status, or sexual behaviors. However, the caveat to all of this is that over twice the number of our participants are having to go to multiple different locations all around Orange County in order to have all of their mental and physical health care needs met. This goes without saying that that creates yet another barrier for the LGBT plus community in the area. It is also important to note that 95% of them are interested in the idea of a one-stop shop, which is what John brought up earlier, that simply refers to a place that they could get all of their medical, mental health, dental, case management, food pantry, and health education services provided all at one convenient location. Next slide, please. We now believe that we have a much better understanding of the healthcare and mental health care experiences of those living in Orange County. Of the collected answers to our questions, we believe that the aforementioned results are interesting findings in and of themselves for pilot study data. However, we do believe that it would still be helpful to conduct some focus groups in order to further clarify some of the experiences. For example, through conducting focus groups, we hope to clarify what the participants define as a somewhat knowledgeable provider, and likewise the information that they would expect for a competent healthcare provider to know beforehand about LGBT plus care. We would also like to find out where and how they're getting their information primarily. Is it primarily from word of mouth? Do they have access to online information? Or perhaps would they be interested in having a directory that would help them better find places to receive care and find healthcare providers? By allowing us the opportunity to talk to the participants in depth, focus groups will also give us the opportunity to hear if they have any suggestions about how to remove any perceived barriers or how we can help them reduce the cost of their care. Next slide, please. We were continuing to recruit for our study and did an IRB modification in order to help us expand our recruitment ability online through social media. And we were able to get a few more participants that way. And recently we decided that we are ready to close our survey so that we can now embark on a more full and thorough analysis of all our data. Secondly, in the near future, we plan to conduct some focus groups that will allow us to gain a much better and deeper understanding of the answers and experiences that were provided to us by our participants in our original survey. And lastly, we plan to submit our manuscript within the next 6 months, which would provide data that has not yet been collected in Orange County before, and which could help other studies regarding the LGBT plus community all around the country. Next slide, please. Now to recognize some limitations. First off, we use the convenience sample, and as such, our data cannot be generalizable to a larger population. And as previously mentioned, we acknowledge that we have a limited sample size. However, we feel that that is okay since this is a pilot study and no one else thus far has recorded this type of data. Another limitation is also going to be the COVID-19 pandemic, which stopped additional recruitment activities that would have otherwise occurred last year. And furthermore, a full analysis of our data is still in progress. Next slide, please. Thank you very much.
Awesome. You guys did an amazing job. Thank you so much for that presentation. There's my contact information. And that concludes our presentation. Thank you very much. Okay.